It's Sunday afternoon, and the emergency services are working flat out at the health centre in the Spanish town of Tui. Over 100 patients come over from nearby Portugal every month. Carina is a doctor and has been working in Tui for years.
I've worked in Portugal as well. I found out that patients had to drive 30 kilometers with a cut wound because there was no doctor to treat them.
Only the river Minho separates Tui from its neighbouring city in Portugal, Valença. Healthcare has become more expensive in Portugal, now that patients have to pay extra for doctors' visits and medication. They also have to put up with long waiting times.
I came for the results of my blood tests. I had to pay €5 for just a piece of paper.
People have to wait, and some don't even make it to their operation date.
A year or 2, 6 months, it depends. Some people go to Spain. My daughter went to Spain for treatment.
Many Portuguese people are angry. In protests 3 years ago, many defiantly waved Spanish flags. The Portuguese health system suffered from drastic cuts. Valença no longer had all-round care, so emergency cases had to drive hundreds of kilometres to the nearest hospital. Tui was closer. José, a waiter from Valença, took part in the demonstrations when the cuts came. He wanted to thank the Spanish for treating Portuguese patients in Tui.
We prefer being Spanish rather than Portuguese in that respect. Lots of places here are doing badly. You have to travel a long way and there isn't any public transportation. You have to rent a car to go to the doctor. Calling an ambulance might be more expensive than getting a taxi.
And many of the costs come out of the patient's pocket. It's a lot to ask at a time when the Portuguese are earning less money, €770 a month on average. But the health authorities say they are proud of the reforms.
The numbers speak for themselves. Emergency admissions have gone down in general, and the reform has reduced the number of emergencies that aren't really urgent.
Uniminho has a different notion of what constitutes reform. The organisation wants towns on the border to work together to build up a network of health facilities. Portuguese patients should be able to visit Spanish doctors at no higher cost and vice versa. But the fight has already been going on for years.
The problem is that political will is lacking. We are one of the most heavily populated border regions in Spain and Portugal. We have good infrastructure, so we could be a good role model for the benefit of the people here.
Doctors in Tui are all for Europe-wide regulations, which would also cover patients who visit the region from other countries.
If we're building a European Union and breaking down boundaries for people, we should also be breaking them down in the health system.
But that is little help to Portuguese patients at this moment in time, and Spanish citizens have a reason to fear health cuts themselves.
I lived through a war. It was very bad for us. Now we're very well off, but it will go downhill.
Lots of doctors and nurses are leaving the country now. The best personnel is definitely going.
I really hope that we don't become like Portugal. But we're on our way there.
Indeed, the Spanish government has hinted that Spain may soon be following the Portuguese example. The free health system that the Portuguese were once so proud of is now fast becoming a mere memory.